Basically, what we're saying is just that people have surgeries all the time, right? And whenever they have surgeries, aftercare is really pushed upon. So they're encouraged to do isometric exercises, range of motion exercises, things that will really help reduce scar tissue and reduce the chance of having restricted range of motion and pain and complications that develop. Unfortunately, when it comes to breast augmentations, there's very, very little patient education. So it's like aftercare isn't really something that's talked about enough. Rehabilitation isn't something that's really talked about enough or encouraged enough. And breast augmentations are a really traumatic surgery for the body because you're moving around the muscle, you're tearing into the skin, you're stretching out the skin, stretching out the fascia, lymphatics, blood, like all of that is affected, right? And you're placing something foreign in the body. So the body, of course, recognizes that something foreign is in it. And so the fact that it develops adhesions and scar tissue and stuff like that is really, really normal. And again, because aftercare isn't something that's encouraged, people don't really do much, right? Other than just like the very basic treatment for the scarring. And so what you see is when people, after they recover, right? So sometimes even years after, you see complications such as keloid scarring, or you see people have really restricted range of motion in their arms, right? Because all that skin is pulling. So some people can't even lift their arms past 90 degrees. Another thing you see is people have pain and they start getting puckering in their breast tissue. And then even aside from that, right, is if the scar tissue is bad enough, the fascia is restricted enough, you see that the implant actually starts moving around and isn't as aesthetically pleasing as it was, right? Because of that tightness in certain parts, it shifts over. And that's a really big risk, right? So with massage therapy, it can be incredibly beneficial for people who've had breast augmentation, because with massage therapy, you work on breaking down that scar tissue, stretching out the fascia, stretching out the skin, stretching out the muscles around it. And that way you're reducing the adhesions, you're reducing the scarring, you're reducing the pain and the restrictions that come with a traumatic surgery. And aside from that, you know, it can reduce the chances of a more long-term complication. So another thing that we were talking about before the treatment is around the breast tissue, there's a lot of lymphatics, right? There's a lot of lymphatic vessels, and they basically drain behind the breast. So with breast augmentations, the lymphatics are often not circulating as well as they should. And that submammary space, so the space behind the breast, is restricted, and that's where adhesions and stuff can form as well. So one technique, so home care that can be given to a patient as well, can really be beneficial in opening up that mammary space and even helping with circulation and lymphatics as well, to just help with regular tissue health, right? So that's some of the very big reasons why treatment on breast after breast augmentations can be really beneficial. Mm-hmm. Hopefully that was clear.
Yeah, that was clear. Yeah,
Awesome.
This burning right now, right? Like that's cool to feel it.
Yeah. So when it comes to fascial restrictions, so fascia is basically this tissue that's like this layer of connective tissue between muscle and skin. And so it basically keeps your muscle and skin from rubbing with each other and causing any friction. When it comes to fascial tightness is something that's very normal and it just happens. But when it comes to surgeries and stuff like that, obviously the skin has been stretched out and the fascia can become really tight as well. So with things like myofascial releases, you're really working on stretching out that fascia to reduce that tightness and that pulling that some people are getting when they, for example, move their arms after breast augmentation. So that fascial stretching can feel kind of like a burny stretch on the skin. But again, it is temporary and it is highly beneficial.
Cool. Very cool. Yeah, I had few clients that have it. I had a client once. She couldn't lift her arms to hold the barbell.
Yeah,
could not. So she just couldn't have the barbell on her shoulder.
Absolutely. Yeah, like we were saying, like I was saying earlier, with restrictions with arms and shoulders, it's so common because all of here they develop scar tissue deep down. So sometimes they can't even really lift their arms because all of this kind of gets scarred together and stuck together. And that's just, it's a shame that people don't know enough about rehab that they can do to help with that.
Interesting. Very cool.
Mhm.
Thank you so much.
Thank you.